miles, and I drive just for that.
Oh, wow. How about that? That's exactly right.
All right, so we're going to go ahead and get started. I already told my audience that you are a cardiothoracic surgeon, and you have a book, and you're a professor. So we're ready for you to kind of enlighten us on the better way we can be healthy, because we know that it has been forecasted that in the next 7 years, 23.6 million people will die from heart disease. So can you tell us what are some misconceptions about heart health?
One of the main misconceptions, Loretta, is that heart disease only affects the old, overweight, diabetic, drinker, smoker. But the fact of the matter is the data parses out something much different. I have operated in my career on thousands of people as young as age 27 years old. So this is a disease that can affect anyone at any time.
And it's, we also read that in the next 3 minutes, 3 people will die in the United States from a heart attack. So where do we start to help build better heart health? We got to start somewhere. And starting with the misconceptions, I think, was a great place. But can you tell us something that what can we start with, all of us?
Healthy lifestyles lead to healthy hearts. And within that lifestyle, diet is the number one factor to build a better heart health. But most people think it's difficult. It doesn't have to be. I love peanuts, for example. And peanuts have been shown to reduce heart disease as well as diabetes. The southern peanut growers, for example, know that peanuts and peanut butter are easy to include in a heart-healthy diet. Peanuts have mostly unsaturated fats and offer heart-healthy nutrients like fiber, magnesium, vitamin E, and most of the protein of any nut. So try a twist on a PB&J. And replace the jelly with fresh fruit on whole grain bread, or add peanuts to a salad or stir fry to feel good about frequent consumption of this very tasty, heart healthy food.
I love peanuts, and I never thought to substitute the jelly or the jam for fresh fruit.
There you go.
Oh my goodness. So that's my takeaway. I know you're giving me some more. So what are some other solutions to improve heart health? You already started with the dieting. Is it that other thing that we don't want to do at all, and that's exercise? What do you say?
Regular exercise and movement is critically important. That's number 2. That's why it's never too late to kickstart your fitness journey and get moving. And there's no better time to do that than in February during Heart Health Month. Planet Fitness, the judgment-free zone, is a great way to help people achieve their fitness goals, boost overall energy, promote physical and mental well-being, and better your heart health. So throughout the month of February, and in honor of Heart Health Month, Planet Fitness will be showing their love with a free heart healthy workout collection on the PF app. Ranging from cardio to yoga to toning, each workout is designed to benefit your heart health, boost your mood, and increase your energy. So,
Dr. Cooper, can you tell us some of the warning signs? Because, for a long time, all we thought was, chest pain, left arm, sensation. So I know it's more to that, because those things could be anything. So what are some of the warning signs that we need to be aware of and pay attention to?
Absolutely, Loretta. Thank you so much. Shortness of breath is one of the things that people often do not attribute to their heart. Chest pain for sure, but sometimes that chest pain can be a little atypical, not your running down the arm or jaw pain that we hear about on TV or on ads when they talk about these things. But here's the other one. Since we're talking about fitness, it's very important for you to exercise. Why? Because that exercise is a stress test. If you notice a reduction in your ability to exercise, then that could be a warning sign of heart disease.
Okay, so shortness of breath. And for women, is it more subtle, or is that some kind of myth? Is that a medical science answer that women may not feel the shortness of breath and can have a heart attack, nor the tightness in the chest?
That is absolutely correct, Loretta, in that women do not experience the typical signs of heart disease like men, younger patients, etc. And so for women, it's very, very important, again, to be very in tune to your body. Sometimes you just have anxiety. Sometimes you have entire muscle aches all over your body. These things are very, very important for women to understand, that the symptoms and signs of heart disease in women in particular can be very, very subtle, and you may not even think that it's pointing to your heart. So very important point for women especially.
Oh, and that's so scary, because I have a friend, and she actually went to the doctor because after the fact, but she had already had a heart attack. Is that myth, or is that her mind, or did I misunderstand? Can that happen, that you could have a heart attack and it not cause you to immediately go an ER visit?
So let me just say this to you. In fact, a number of people, and women especially, and diabetics especially, can have what we call silent heart attacks. They show up in their doctor's office or the ER, or they're getting a checkup, and then they look at the EKG, and the EKG shows that there's evidence here that you may have had a heart attack in the past. It happens all the time. For men, for example, it's the indigestion. It's the bad night after eating the, quote, chicken wings, and you feel like you've got heartburn. Well, guess what? That really was your heart burning. And you may not go in and get treatment for that. So yes, you can have a heart attack. Have it be silent, or have the symptoms not compel you to go and get any further treatment or evaluation. And sure enough, later on, somebody says, oh, you've had a heart attack.
Ooh, that's a good segue into your book, because I can go in there with those questions. I just love making sure my audience understands this, what it really is and not what they thought it was. Right. So can you tell us about your book, Heart Attack, Truth, Tragedy, and Triumph?
Yeah, so that was my segue into becoming an author, but it was also catharsis, getting these messages out there, the things that we've talked about already. So the truth is about my family, personal family history. Heart disease, cancer, you name it, ravaged my entire family. Most of who died before the age of 60. Nobody made it beyond the age of 58. Out of 8 kids, I'm one of 3 that's still alive. So I talk about those stories because in those stories is everything that I see in our healthcare system that we can do better with. The tragedy is the fact that the vast majority of those things that affect us are preventable. 80% of what I do as a heart surgeon, quite frankly, comes from unhealthy lifestyles, family history, and things like that, but things that we can actually impact. So it's a tragedy that we don't do those things that we can do to prevent these things. And then the triumph is just that too, is that yes, you can. You have the power. You can change your lifestyle, your eating habits, your exercise, your relationship with food. You can do those things to empower yourself to live a long, happy, and healthy and a joyful life.
So I just got this. This is crazy. So a broken heart. Was that medical or was it emotional when it first came out? And do you know? And can a broken heart be repaired medically?
Yeah. That's a very good question. So it's both. It is literally a heart that, because of a very strong emotional stimulus, death of a loved one, any type of trauma that creates that type of an emotion in you, can actually lead to an outpouring of a number of different factors, hormones and proteins that affect your heart. And so we call that Takotsubo, named by the person who sort of first described it, heart failure. And essentially, it can be very, very devastating. Because when you look on the heart catheterization, there's no obstruction of blood flow, which is what we look for typically in these heart disease cases. There's no problem with the heart valves, but the heart just doesn't work. And so, yes, it can be. One of the main things we need to do is support the heart first, so that we make sure that we're optimizing the blood pressure, we're optimizing the heart rate, we're making sure the patient's getting adequate oxygen. There's also some things that we can do from an advanced interventional perspective to support a heart that is broken in that manner. And so, yes, it is emotional, a very strong emotional stimulus that leads to a broken heart. So it's a real phenomenon for a lot of people every single day.
I want to ask you, because I know you're one of the leading experts in this field. So when the NFL player Damar Hamlin had his cardiac arrest, I got to go here because people are talking about it. Was it really like an isolated kind of miracle kind of thing, or is it something that can happen to a lot of people who it doesn't always result in death? How do we know? Or I don't know. What's the phenomenon behind that? Yeah.
This is great, Loretta. Thank you so much for asking that question. I was thinking about that before you even asked this. I hope she asked me that question so we can talk about it. Commotio cordis, C-O-M-M-O-T-I-O, commotio cordis, basically happens when you have a very strong impact to the chest at a particular time in the cardiac cycle. So when that electricity goes through your heart, makes your heart beat, if you hit it at just the right time, you can actually completely disrupt all of that electrical activity and you go into what we call ventricular fibrillation, which is not compatible with life. And that's why they acted so fast in the Damar Hamlin situation. Now, I don't have access to his medical records, but that is the theory behind what happened to him. Now, it's very, very important to know this. This is a very uncommon thing to happen in that setting. In fact, commotio cordis has been shown to occur more frequently in baseball, getting hit in the chest with a baseball. That's where it affects more athletes. Also soccer, for example. Other sports where they're throwing projectiles around. Those are the places where we see this. This is the first time I've ever seen a case of commotio cordis on a football field. There have been football players to collapse on the field and die related to actually having heart disease. So a very rare phenomenon. It's something that parents should be aware of. You don't need to go out and do some weird test. Your kids should just have normal kind of testing and evaluations by physicians for physical sports, permission to get into those physical sports. But very rare occurrence, but it just happens, it's like the stars are lined up perfectly. And when he got hit in the chest, it really it basically jolted his heart at a very vulnerable time in the cardiac cycle.
Wow. Okay. You promise me you'll come back because I have a lot of questions, but I know you have to go. This is one of my sweet spots. I love sharing information, removing myths, and trying to get people comfortable with having these conversations. So Dr. Cooper, thank you so much for being my guest today. I appreciate you so much.
Thank you so much. And for more information, go to tipsontv.com. We look forward to having you come there and get all this information that you need.
All right, everybody. Thank you, Dr. Cooper. He has to go, but he's going to come back. I can assure you, I will find him and make sure he comes back.
Absolutely. I look forward to it, Loretta. Thank you so much.
Thank you. Bye-bye. All right, everybody. So I just feel so good about presenting information like. All right, we're clear.
Awesome. Love that. I mean, she got a full district.